My name is Dr. Sonali Shah, and I am a hematologist and medical oncologist at the Seacoast Cancer Center. When I was doing my internal medicine residency training in Boston, I found myself really enjoying taking care of cancer patients on my oncology rotation. One of the things that I love about patient care is longitudinal care, taking care of patients over long periods of time, because you really get to know them, not just as patients, but as people. When I was working on a bone marrow transplant as a resident, many of those patients end up hospitalized for several weeks, and so you get to round on them every day, and you get to meet them and talk with them. And I became really attached to one particular patient I remember who was undergoing a stem cell transplant for multiple myeloma, and began thinking to myself that this is really something that I would love to do long term. I grew up singing Indian traditional songs, but then joined a choir when I was in high school and college, and then when I was at MIT for undergraduate studies, I did a concentration in music. Well, one really great way to connect with patients is to share the hobbies that you do. And so if they have a hobby such as drawing or artistry or singing, it really brings us together and makes our connection stronger, and it really helps the physician-patient therapeutic relationship. The thing that I appreciate the most about Wentworth-Douglass is how much people care about each other. There's the science of medicine, and then there's the art of medicine as well too. And it's not just about knowing which chemotherapy to give patients or what labs to check, but it's also about caring for the patient as a whole. And everybody from the person who meets the patient at the front desk of the cancer center, to the medical assistant who escorts them to their room, to the physicians, to the nurse practitioners, to the infusion nurses, to the scheduler that the patient sees when they're leaving the clinic. Everybody tries to help in their own way and will go even the extra mile for the patient. That feeling of care for the patient that is above and beyond just the science of medicine, seeing that art, that's what gets me up in the morning every day to come to work.